If you're just joining us, I'm your host, Andrea Williams. We're discussing COVID-19 this morning, and my next guest covers a range of African-American issues as an award-winning columnist for the Milwaukee Independent. He's also the lead trainer and consultant with Nurturing Diversity Partners, and he volunteers as head griot for America's Black Holocaust Museum in Bronzeville. I'm happy to welcome back to Our Issues Milwaukee, Mr. Reggie Jackson. How are you?
I'm doing well. How are you doing today?
I'm doing well, and I'm glad to see that you're doing well. How's the family?
The family is doing really well, with the exception of one of my wife's cousins is actually in the hospital fighting for her life with COVID-19 right now.
Wow. Yeah, it's like everywhere we turn, we're hearing about COVID-19, and that's why I wanted to talk about this and get a different perspective. We know COVID-19 does not discriminate with millions of people dealing with this across the globe, but this pandemic is having an especially hard hit on the minority community, especially right here in Milwaukee. At this time of the recording, the majority of the deaths in Milwaukee County are African American, and they live on the north side of the city. And we know that health disparities in Milwaukee have been a subject of concern for years. Being considered one of the most segregated cities in America has had a considerable impact on the overall health of the state. And in America, we know that people who struggle financially also struggle to stay healthy. So give us your perspective when looking at the history of health disparities, specifically in our city, and what we're seeing take place now.
Yeah, Milwaukee unfortunately has some of the worst health disparities between African Americans and other residents of the city, and this has been consistent for a number of decades. Unfortunately, a big part of it has been due to people not having the same quality jobs that people had, 30, 40 years ago, where they had easy access to medical care. Nowadays, people work jobs that don't allow them to have access to health care, so they don't have primary care physicians that they see on a regular basis. For a number of people that I've spoken to, there's still a great deal of fear of the medical profession in our community, going back to the Tuskegee syphilis experiment that many people are aware of, but even going back further than that, anecdotal stories that they've heard from their families. A lot of people in Milwaukee come from down south, Mississippi and Alabama, and a lot of, stories that they've heard about the medical profession. So that lack of faith, lack of trust in the medical establishment, on top of people not having regular access. We think about the hospitals that closed, St. Michael's Hospital that closed, Northwestern General. People aren't close to where hospitals are either.
Oh, that all makes sense. And when we look at some of these health disparities, an estimated 74% of African Americans had their high blood pressure under control, compared with 84% for whites. Then you've got Milwaukee County has a high rate of poverty, ranked 71st out of 72 counties. And the truth is, low income populations, regardless where they live, rural or urban, will be hit hard at times like these. So by one measure, someone living in Milwaukee County is almost twice as likely to die before the age of 75 than someone living in, let's say, Ozaukee County. So when we look at this particular situation with the history of health disparities that we've discussed, you actually wrote with your column about the tragedy of 9/11 and how it brought Americans together back in 2001, but how racism still was able to rear its ugly head when the whole storyline came out that there were Muslim men who were involved with the 9/11 tragedy. And so we're seeing the same things happen with the coronavirus originating out of China, and people throwing the negativity and the blame on Asian Americans.
Mm-hmm. Yeah, and that's very unfortunate. Out in California, when the outbreak started there were a number of news stories about Asian Americans being verbally assaulted in public, physically assaulted. We've had a a Chinese restaurant here in Milwaukee that literally closed their doors because people kept intimidating them, intimidating customers who were trying to go there. So, this is something that is an unfortunate part of the society we live in. Those racist ideas and assumptions people have. People always look for someone to blame when tragedies like this happen.
Mm-hmm.
And unfortunately, our Asian American community, whether they're Chinese or Hmong or whatever, people don't know the difference. They're going to suffer tremendously as a result of this, the stigma.
Yeah, it's really extremely sad. And looking at just deaths and confirmed cases of COVID-19 spiking in Milwaukee's Black community, in your opinion, do you think that this will be a situation in moving forward that the disparities that exist will be looked at and dealt with so that we can change the narrative for once and for all?
Well, I'm hoping that that's the case. As we look at people who get the virus, people who have underlying conditions like hypertension, high blood pressure, diabetes in particular, those are causative factors that if you get the virus, you're much more likely to become very ill with it, much more likely to die. And because those rates of those conditions are much higher in the African American community, these are things that as we move forward, we're going to have to really be very careful about how we handle people with those conditions and help them to manage those conditions to the point that they get past having diabetes, they get past having high blood pressure. We need to really, really emphasize that because this virus, it may kind of die down, but it may be around for years. We don't know.
Yeah, we don't know. And it's important to remember how incredibly difficult some people's lives can be on an everyday basis. Then you add a pandemic, and they're faced with all of these situations that include a lack of public transportation, having nearby grocery stores, healthcare, and all of this becomes huge barriers in helping people stay safe. So it's not just here in Milwaukee that we're seeing this happen. You've got populations such as Chicago, Detroit, New Orleans, all of these urban areas with, some even higher population of African Americans that are seeing these same things take place.
As we kind of track this around the country and we're seeing those cities that you mentioned, I've been telling people this is really just the tip of the iceberg. We're still very early into this pandemic in the United States. And even as I've been tracking the cases here in Milwaukee County, initially the first week and a half or so, you could see the map and see that most of the cases were on the north side of the city. But as you see it progressing over the last week or so, we're beginning to see cases in other parts of the community, and other, even some of our suburban communities in Milwaukee County. We've seen the first death of a white person and a Hispanic person in Milwaukee County, when all of the first 10 deaths were African Americans. And so, we're going to continue to see this, and it's exacerbated by the poor health conditions of people. And also the other factor that plays a role when you talk about grocery stores, people eat very unhealthy diets when you're poor. You're much more likely to eat fast foods, which contributes to obesity, which is another underlying cause of you getting sicker from this disease. So all of these things that I've told people about in terms of the economic status of African Americans, we need to solve poverty in order for our community to be healthier. Crime goes down when people aren't living in poverty. People are much healthier when they're not living in poverty. And now we're seeing, disinvestment in those areas where we haven't taken care of those problems well enough, really wreaking havoc in African American communities here in Milwaukee and Chicago and Detroit, New Orleans, New York. All of those cities have similar disparities in terms of their African American communities.
Absolutely. Well, I really thank you for coming by. Of course, this pandemic, like I said in the beginning, does not discriminate, and our prayers are going out to everyone who has been affected directly and indirectly, regardless of their race or their socioeconomic background. But we wanted to shed some light on this particular situation that brought a CDC group here that has made national headlines and needs to be talked about. So I thank you for your time and all that you do for our community.
It's always a pleasure. Great to see you again, Andrea.
Thank you. And you take care of yourself. Reggie Jackson's the lead trainer for Nurturing Diversity Partners. And you can also read his outstanding columns right there in Milwaukee Independent. It's been a pleasure. You take care.
Yeah, you too. Be well.
We're going to take a quick break and we'll come right back with more of Our Issues Milwaukee dealing with COVID-19 right after this.